Hello and welcome to the channel. My name's Vincent and I'm coming to you from the United Kingdom. Right off the bat, I'm not a doctor and none of this is medical advice. I'm just some random guy on the internet. Who knows? This may be the ramblings of a madman. In this video, we will discuss some of the work by Professor Thomas Seyfried, who has stated after years of research that cancer is a metabolic mitochondrial disease and not a genetic disease, as believed by the current dogma. Just listen to what he has to say about brain cancer, and specifically glioblastoma and the current standard of care.
But their complete lack of understanding of what their actual standard of care treatments are actually doing to contribute to the rapid growth of the tumor in the brain. So as I have published very clearly over and over again, when you irradiate somebody's brain with a tumor in it, you explode the amount of glutamine in that microenvironment, giving those tumor cells an absolute a bouquet of growth factors and fuels to grow out of control. So you create a mush in the brain. You give the patient high-dose steroids to control the swelling of the brain from the radiation heat. Steroids are like drinking Coca-Cola. They make your blood sugar go up to very high levels. So what are you doing? The very treatment that you're throwing at these poor folks is contributing to the recurrence and the death of the patients. And I've said that over and over again. Why there's so little survival for glioblastoma? In every major medical center in the world, it's so consistent that people are all dead before 40 months. Not all. You get very rare survivors occasionally. Almost everybody in 10 years is dead for sure. What are you doing? I said that's the worst thing you can possibly do to somebody with a brain tumor is irradiate them. And yet they continue to do it. And one has to say to these guys, what's wrong with you? What do you ignore the scientific evidence? What are you doing to these poor folks? I've clearly shown that that's what's creating the recurrence of the tumor and killing the patients. Why? Because it frees up massive amounts of the two fermentable fuels needed that's the science behind it. You got to understand the science behind what's going on. And it makes perfect sense why these folks are not surviving. They look like they're doing well for a while, and then all of a sudden, that tumor comes back like a raging bull, and the liquefaction of the brain from the radiation, it's just like, it's tragic. It's malpractice as far as I'm concerned, to do something like that. It'd be one thing if there wasn't any evidence. It'd be one thing to say, well, this is the best we can do. But when I publish evidence and I clearly show that treatment is responsible for the demise of the majority of these brain cancer patients, it's criminal to be doing something like this. I'm telling you, man, this is like nuts. And, people are saying that, it's hard to reproduce science. There's nothing, you should see how reproducible the death of the cancer patient is. You can't design better experiments for reproducibility than how fast standard of care kills GBM patients. That's terrible. Isn't that terrible to say something like that?
Wow. That is absolutely scandalous. Just unbelievable. The fact that they know and yet they still do it. Just words fail me. It's absolutely beyond belief. And if you are a glioblastoma patient, please see the link in the description to Professor Seyfried's presentation on the matter.